So would you call that intact?
These are intact
Yeah,
kidneys,
okay.
yes. If somebody needed...
Because if I looked at that, I'd be like, that's good to go.
Oh, yeah.
That's like 21.
Yeah.
5 stars.
Yeah, you could start a neural cell culture from this neural tissue right here.
So even at 11 weeks, even though it's really early, because I know that's when we talked about
This is neural tissue that people could take and look, and you see how it's still connected through the spinal cord back there. If you
we just send that all together, and they pick it out. Or
you could actually, yeah. Yeah, some people prefer that actually because it keeps it a little more protected. Yeah. That 11.6 was pretty good. There was there was like 3 or 4 samples we could have taken out of the 11.6, so that would be if we were doing like 50 to 75 per specimen, that would be like 200, 300, right? And we'd be comfortable with that. But like so it's like stuff like this, like we don't want to be like just a flat fee of like 200 and then it's like
no, and I think the per item thing works a little better just because we can see how much we can get out of it.
Intact hearts these days because they're looking for specific nodes. AV nodes, SA. I was like, wow, I didn't even know. Good for them. Yesterday was the first time she said people wanted lungs. And then, like I said, always as many intact livers as possible. People just want
livers.
People want lower extremities too, which that's simple. I mean, that's easy. I don't know what they're doing with it. I guess they want muscle. But
Yeah, a dime a dozen.
That's an interesting concept. Let me explain to you a little bit of a problem, which may not be a big problem. If our usual technique is suction at 10 to 12 weeks, and we switch to using an iPass or something with less suction in order to increase the odds that will come out as an intact specimen, then we're kind of violating the protocol that says to the patient, we're not doing anything different in our care of you. And to me, that's a kind of a specious little argument, and I wouldn't object to asking Ian, who's our surgeon who does the cases, to use an iPass at that gestational age in order to increase the odds that he was going to get an intact specimen. I think, they're both totally appropriate techniques. There's no additional pain involved. I don't think the patients would care one iota. So I'm not making a fuss about that.
Okay. And are we agreed that $100 would keep you happy?
Well, let me agree to find out from other affiliates in California what they're getting. And if they're getting substantially more, then we can discuss it then.
Yes.
But the money is not the important thing.
No,
But it has to be big enough that it's
But
worthwhile
it
to
is something to talk about. I mean,
It's been years since I talked about compensation, so let me just figure out what others are getting, and if this is in the ballpark, then that's fine. If it's still low, then we can talk about it. I want a Lamborghini. I said I want a Lamborghini.
Don't we all, right?
Yeah, exactly.